at an outset. It's my proud privilege, and I'm almost on the moon for having got an opportunity to introduce Dr. Shriram Nene. I would like to welcome Dr. Nene and rest of the guests who are on the dais and off the dais. So far as Dr. Shriram Nene is concerned, he is a cardiovascular and a thoracic surgeon. He's a healthcare innovator, Bollywood film producer, health and wellness social media influencer, and an educate pioneer, who is currently residing in Mumbai. He's born in London, but has been raised in US. And Dr. Shriram Nene studied medicine and practiced as a surgeon for almost about 17 years. He came to India in 2011 and started his entrepreneurship journey by co-founding RNM Moving Pictures and world's first gamified online dance academy, Dance with Madhuri, along with his famous Bollywood actress wife, Madhuri Dixit Nene. Dr. Nene married fabulous dancer, diva, and everyone's favorite, Madhuri Dixit, in 1919, and they have two children, Arin and Ryan. During COVID pandemic, Dr. Nene gave a helping hand to municipal corporations all over the state to strategize and contain virus, and has launched health tech startup called Pathfinder Health Services Private Limited, whose primary focus is to develop personalized precision healthcare journeys. Now we have an introductory CD for Dr. Nene. So over to team to show his introductory CD.
May I please request our chief guest, Dr. Shriram Nene, to release our another first this year, the MOGS CD, Wellness of Women Through Ages. May I request the contributors, Dr. Pratik Tambe, Dr. Preeti Vyas, Dr. Pradnya Changire, Dr. Preeti Deshpande. Yeah. That's why I stopped. So maybe we can arrange the contributors while we start with our video.
Can we have an introductory CD?
This is Dr. Nene. I practiced as a cardiothoracic, vascular, and general surgeon in the US for almost 20 years, some of the most rewarding years of my life. I now have an opportunity to work as a health tech innovator whose goal is simple: to improve lives and lifestyles by increasing awareness and access to world-class international medical standards. This channel is a part of that effort, and the idea is to explore the best practices in healthcare globally. So join me on our journey to make the world a better place.
We now move on to the CD release. I request all the contributors to please come on the stage during the release. Yeah.
Thank you so much. I just want to say about this CD. I'll just brief. This is again, as per the theme of the year, there are 4 presentations which are done by my brilliant team, very ably edited by Dr. Pratik Tambe. Please come up on stage, Pratik. Pradnya Changire, Dr. Preeti Vyas, and Dr. Riddhi Desai. And I hope this common message goes out to all our outreach meetings. We can give this CD, with these presentations. And thank you so much for working hard on that. Thank you.
We now move on to our next segment, where our President, Dr. Suvarna Khadilkar, will initiate a talk with Dr. Shriram Nene, which is titled as A Heart to Heart, a Dialogue with Dr. Shriram Nene.
So, Dr. Nene, when I told him we would like to hear from you, so he said, no, Suvarna, I would like to have a dialogue with you, and I'll have to have a heart-to-heart talk with you. And even the audience interaction is welcome. So, Dr. Nene, how do women present differently when they have a heart attack? Because we have seen women just don't come to the doctors, and women are brought to the healthcare facility only when the illness has advanced. So do you think they present late, they present differently?
So first, I wanted to thank you for having me. It's an absolute honor and privilege and to be here tonight. And congratulations! I can
Thank
think
you
of
so
no one
much.
better
Thank you so
to be in your position now, leading this. And I've enjoyed this thoroughly. I look forward to meeting all of you guys at some point. To your question, look, half of India is women, right? And there was a very good study out of Europe last year in the heart failure symposium, which suggested that women who have heart attacks actually have a 2 times likelihood of dying of them. And several factors lend to that. The first is the biology of the disease. Women are protected until they hit menopause, and then after that, their falling estrogen actually changes their whole lipid profile.
Absolutely.
And so the likelihood of them having heart disease afterwards, particularly in cases where they have heart disease as a risk factor, whether it's family history, their habits, or their lipids or other things, it becomes there. The second thing is, I think all of us will admit that women tend to put themselves last, whether it's your mother, your
Absolutely.
wife, or your sister.
Very true.
And so even when they have symptoms which are fairly atypical, not 100% chest pain radiating to your arm with shortness of breath, they don't always recognize them. And so they often come in late. Then the last thing is, when they come in, is it taken seriously? And I don't think enough attention has been given to the subject. I don't think we've spent enough time looking into what we can change with that. So I think, look, in India, I would like to say that how we change this is to work together and to join hands and raise awareness. Because where I see the problem as is a lack of awareness and a lack of access to world-class evidence-based international standards. What's clear is some of the smartest people on the planet are here in India. You take them anywhere on the planet, they become the head of Google, the head of Microsoft, all of this stuff. But when you look here in India, we have all of these people. Now the question is, with doctors, there's only 1 million doctors serving 1.412 billion patients. And it's not one India.
Very true.
28 states, 8 union territories comprised of 30% metro, 70% rural. So the mission then is to take that care. And I love your theme, what you're doing from the early stages all the way through senescence, looking at health as a continuum rather than an acute care event. We need to turn the clock back, the pendulum, to prevention, early recognition, early treatment. And in the case of heart disease, the way we do that is we raise awareness, we identify risk factors early, and we intervene early so that your heart muscle is preserved.
Absolutely. Actually, I'll tell you, even I'll go one step higher, or I'll go back in the sense, as obstetricians, we are even responsible for the fetal health. And there is a concept of, the adult disease, which begins in utero. So if we take care of our antenatal women, the prevention will start from there. And when then through infancy, through childhood, through the youth, to menopause and senescence, I think every age needs some support, some strength, and they need to sustain their health throughout their lives. I think so. Obstetricians are in a special position to even take care of in utero women. Now, I was just thinking whether in US, did you have any opportunity to do heart surgeries during pregnancy?
Yeah. So we interacted with OBGYN often. Sometimes it was in cases where they were doing cancers, got into vessels, we helped them repair them and got out of there. But I think one of the highlights was I had a 32-year-old patient who I got a call from the cardiologist, and for a heart surgeon, it's always in the middle of the night, in the nick of time, right?
Just
And
like obstetricians.
same
even.
for you guys, and so we share a lot in common that way. And so what happened was she, during pregnancy and afterwards, the fluctuations in volume as well as in hormones causes an interesting mix in the arterial kind of structure. And there's one type of ailment called a coronary dissection, where the actual artery dissects and it between layers it tears apart. I got called because there was a 32-year-old gravid female. She was 32 weeks along, and she came in with chest pain, was diagnosed with a heart attack. They went into catheter, and at 32 weeks, third trimester, doing a cath is not such a big deal because the fetus is fully formed and you don't have a lot of issues with teratogens and whatnot. But the issue was what to do next. And typically with coronary artery dissection, you can either heparinize them, right? And sometimes it gets better, but in this case, it was in the left main and the left anterior descending. And so they couldn't put a stent in. They called us in to see what we could do. The only way we could do that was to put her on bypass, rest the heart. And in order to do that, we had a joint team with anesthesia, us, and the OBGYN team.
Okay.
And what we did was the OBGYNs, we basically stood by, they induced anesthesia. We quickly, the OBGYN within that 9 minutes did a C-section, fastest one I've ever seen. And they quickly put stitches which would reduce the bleeding and then pack the abdomen. They didn't close it. Then we opened the chest, took veins, and put the patient on bypass, on full
That's so
cardiac
interesting,
arrest,
yeah.
bypassed her heart. Nowadays, you might do it in off pump, which we did back then as well. But in that case, she was an extremis, and so we had to act fast to save her and the child.
Absolutely.
So the baby came out fine. We were able to arrest the heart quickly within 25 minutes, put on 2 vessels,
Fantastic.
and
Fantastic.
wean her off pump. And then we reversed the anticoagulation, which is full anticoagulation, and the worry is for bleeding everywhere. And then as we started closing the chest, they were closing the abdomen. And both mom and baby went home at 5
Superb.
days.
I think that's a great story you just told. I think it's, I mean, we are very, I think as obstetrician, I'll get scared if her heart is going to be open.
But the critical part of this was, think about the symptoms people complain of when you're having a baby, particularly in the 3rd trimester, right? You've got reflux, you've got all the symptoms, which could be heart disease. For that lady to think to come in was a big deal, right?
Absolutely.
And when the chest pain and chest pressure, which she had luckily, didn't get better, she came in, but many women don't. And so this was another example where they're not distinct symptoms, and you may discount them and go in and no one really thinks to ask, could this be heart disease? Because it's the #1 killer of men and women globally. 17.5 lakh people in India die of heart disease every year.
So our women are dying in villages and remote areas, interior of Maharashtra. Considering your digital innovation, he has great innovative thoughts on digital platform, and how these innovations would help save lives of women. Because see, I always feel that technology can reach the villages. The roads don't take you easily. So like if we can go, take your brilliant ideas on digital innovations, how do you think we can help our women who are dying in villages?
So I'll just back up 1 minute. As a heart surgeon, I did close to 10,000 cases in about 17, 18 years, from 93 to 2011. And the issue was this, that you couldn't scale, right? No matter how hard I tried, 2 to 3 cases in a day, 500 open hearts in a year, and another 2,000 consults. Look, there's now 8 billion people on the planet. As doctors, we cannot scale our instance. The only way we're going to do this is to use technology. And what we're looking at is using media to raise awareness and engage, enlighten, and entertain. Because if they feel like they're part of the equation and part of the solution, rather than part of the problem, they will get engaged. The second part of it is to create a cloud-based instance which basically takes everyone's genetics, medical history, family history, social history, and combines it with the resources they have to determine when and where to intervene. And then the last part is to take the smart technology driven medical services thing to give you best in class care. Because there's pathways to all of this. This is how Pathfinder Health Sciences started. But the idea is simple. How do we get to 1.412 billion people in India when only 2% of our MBBSs ever make it out to the rural areas, and that too during our internships, right? And when we studied the problem in India, I was in the US and I said, look, I think we can make a difference here by using technology. And one of the early projects we did, it was to create virtual learning and an edutech called Dance with Madhuri, where we could teach dance. And we had 40 million users in 206 countries engaging. And our biggest problem was because of her brand scaling, we had to redesign the backends. But that knowledge I learned from. And so the one thing is just think about how smart you have to be in this room. It's not easy becoming a doctor. And now think about if you take just 1% of that genius and apply it to other areas to change the way the future goes. I bet you us working together could do something for our patients and for humanity, which you'll look back on, because at some point you'll have everything you want, probably already in this room. And how much can you eat in a day? How much can you live in? How much can you drive? What you can do, though, and the satisfaction you'll get is the intrinsic motivation that you get. And so to answer your question, we're building instances where we triage and we figure out who needs care when, and we give them the means to kind of determine where they are, almost like a digital dashboard, almost like what you have in a car to see when the tank is full, when it's empty, what speed you're going. And no matter which practice you're talking about, whether it's OB, GYN, general surgery, internal medicine, any of these, look, our patients need us.
Yes.
And the problem is there's a finite number of docs. And how we scale this is by using AI, using all of these
Absolutely.
generative techniques, as well as non-generative, and we adopt these early and often. And I look forward to working with all of you guys.
I was about to say, his brilliant ideas on this, you are a social influencer and you have your own innovative ideas. So I think you can really suggest some brilliant ideas for to MOGS on which we
Yeah, so-
can work together and we can
So
take this
is-
agenda forward.
we
So
talked about
that's
this ahead
really
of time.
brilliant. Yeah.
I think that in the pandemic, there was an infodemic as well. Anyone and their monkey brother could get up and say something without any kind of background. We have always believed in using evidence-based, article-based emphasis. And I think as physicians, we need to lead. It can't be the technologists. It can't be the business people. We have to be the leaders in this. And so we created the channel with that interest. That was just one part of the different things we're doing. My view is it's not my channel. It's your channel and his channel and her channel. Because the idea is if we speak with one voice and bring out the best and raise awareness for every patient, the difference we can make in lives is substantial. And look, we're still limited by roads. We're still limited by infrastructure globally. I want to lead from India. I want to make 1.412 billion patients do better in their lives. And from India, we can do things very different at a low cost, high scale. And we take that to the rest of the world. I assure you, not only will our people go and become the head of Google, we will become Google in India. That's what I see happening.
Fantastic. So I think I'm looking forward to all these ideas which we can implement in.
So I wanted to ask you
MOGS,
something. I saw everything you
Don't
stitched
ask me
together.
difficult questions.
No, this will be perfect. So I'm like the designated icebreaker. I wanted to kind of make this a little more interactive with you guys. I saw some magical points that you brought forth. What are the obstacles that you face as OBGYN docs in India. And look, metro is one thing. The South Bombay bed ratio is the same as anything in the West, but it's not one India, right?
Yes.
So what are the things, and the second question is, how can we work together as a country to move that forward with all of these amazing brains in the room?
Yeah. So our Foxy president is here, who's going to take our Indian OBGYN ahead, and he also has brilliant ideas in this. So, but basically the obstacles are in first the awareness of diseases, awareness of health, what is good. So that's why I focus preventive health, because what is good, hardly any few people may be aware. So we have to first create awareness, and the digital platform for this is brilliant because we can connect simultaneously to millions of,
Yep.
if you have a very good platform. So Zoom has come as boon to in this regard. So that is one obstacle. Secondly, we have various there are certain customs in certain areas where they don't budge from their own ideas and concepts, and they don't want to accept what we are advising them. So India is a country where all these multi kind of states, various languages, their own concepts, customs. So these is again, and of course reaching out to them, the infrastructure. But Foxy is doing a lot of work by going down to villages and seeing what infrastructure the maternity homes they have, and we are trying to improve. And as I said, the maternal mortality has gone from 130, 170 to 97, and our SDG goal 31 is 70. So India is very close to 70. So I think all of us, we need an applaud to all these people who are here. They all are doing obstetric care, they are giving care to their patients. So they are doing brilliant job. And across India, we have, Jaideep, we have latest 46,000 members, 42,000 members across India.
Amazing.
They are all working towards improving
I-
in collaboration with government.
I think this is very exciting, and I think we have to be the leaders, right?
Yes, yes.
It cannot be the bureaucrats, the politicians. They have to be part of the journey, and we work together. But I think that we as physicians need to lead this particular thing. The second thing I was going to say is, look, we make films, we do other things. I say tap into your creative genius because it's storytelling at its prime. And how do you engage a culture? You get to be part of the culture.
Absolutely.
And so rather than preaching to them that if you do this, you will end up on the wall like that, you show the picture of the father at the wedding, and he has sudden chest pain falling, and then you show his journey, and that becomes much more compelling.
Absolutely.
And so how we do it, and honestly, as physicians, we don't have time.
Yes.
You spend on average 5 to 10 minutes with each patient, but at the end of the day, it still isn't
counseling is
enough.
very important.
100%.
Yes, yes.
And so I think using our
Very
proxies and
true.
using social media, we've been fairly successful, and I'm happy to help in any way to help you guys scale that. And the idea is to join hands with everyone and make it happen.
Definitely. It was such a wonderful dialogue with you. And I think all of us are quite impressed with your social influencer status and the digital innovations. I really, first of all, apologize for the delay. And secondly, I thank you so much for this, enlightening and inspiring.
I'm looking
thoughts.
forward to her year ahead because she's driven, and her and Satish are very dear friends. I think all of you guys will do something together and change the world. And from India, take it all over the planet. And whether it's an OBGYN or cardiac surgery or in any of the disciplines which we encounter, I see health, good health for all of us.
Yes, I
So
think
thank
that
you
is
for having me.
everybody's dream. The entire nation should be healthy.
So that was really informative. And now we have a very special video of a gorgeous person whom we all love, none other than the better half of our chief guest, Dr. Shriram Nene, the Bollywood star Padma Shri Madhuri Dixit. Please play the video.
I'm very happy that Dr. Suvarna is focusing on preventive care for women at all ages. I'm sure she'll have a very successful tenure. Sending her lots of love and best wishes. The theme of her presidential vision is caring for women through life course. Support, strengthen, and sustain. I wish her and her team all the very best.
That's so wonderful. That's so wonderful. Thank you so much. Please convey my
will.
personal thanks to
I will, and it's our
dear Madhuri
pleasure
ma'am. Yeah.
assisting you in this kind of session to greatness. And I look forward to seeing all of these guys more often and seeing what we can do together.
Sure. Thank you so much. Now I'd like to present you
Yeah,
the
we would
plaque.
request Dr. Khadilkar to present the plaque to Dr. Shriram Nene.
Very nice. Pleasure to look forward to seeing you guys again. Thank you so much. Bye, folks. Yeah, I know very well. Very good. Thank you, everyone.
We now request Dr. Rajendra Sangpal to welcome and introduce our chief guest, Dr. Jaideep Tang, President Foxy 2024.
Thank you.